All right, so my name is Molly Salmon, and back there is Dr. Wendelin. We're faculty members, and I'm an undergraduate student in the Department of Health Sciences. And we're asking for you to let us use materials completed from this educational event, including students from different healthcare professional programs in our research study. And this will help us to see if these events can help teach students about interprofessional collaborative practice. The materials collected will be treated in a private manner. The information that we use to identify you would be removed from the data, and then all the surveys and content assessments and program evaluations will be confidential. You can choose to join the study. There's no reward if you join. There's no penalty if you do not join. The risks from the study are minimal, but could include the loss of privacy related to the opinions you share in the materials you complete. The surveys, content assessments, and/or program evaluations that are completed as part of the educational event should take about 20 to 30 minutes. As these materials will be collected as part of the event, there's no additional time or things that you would need to do if you agree to join this study. And then if you have any questions or about the study or the information in the study, you can contact me or Dr. Wendelin, and our information is listed on the informed consent sheets that I passed out. And you can also turn them in at that table over there where the name tags were at the end.
Hello and welcome again. I'm Patty Stoddard-Dare. I'm a professor here at CSU in the social work program, and I'm also the coordinator for the Chemical Dependency Counseling Certificate Program. And I want to warmly welcome all of you to this event tonight. We're so excited to be here. So this event is a grant-funded event from the Cleveland Foundation, and the spirit behind it is twofold. One is to give students experiences with interprofessional education, and then also the other part of this event is to take a community problem and to use our best resources, our students, to help come up with a solution to this vexing issue facing our community. So in this case, this evening, we're taking a look at the situation of pregnant opiate-addicted women in Northeast Ohio, and we're analyzing the gaps in services and how we can improve the service delivery system for people in that situation. So tonight, I first want to introduce our judges. So we have 3 esteemed judges that we're so happy are joining us tonight. First, I'd like to introduce Tony Niederreiter, who's a nurse practitioner. Please stand. And he currently works at the VA, and he's a captain in the U.S. Air Force. Next, I would like to introduce Dr. Joan Papp. She's with Metro Health System, and she's with the Office of Opioid Safety. And our final judge is Vince Carafi, who is a supervisor of the Cuyahoga County Board of Health, and he's also the chair of the Opiate Task Force. We're also really super happy that we have some community agencies who've joined us this evening. Our students, as part of their project, have identified community agencies that they could potentially partner with in the future, or that could be part of the solutions that we're going to be discussing today. So first, I would like to introduce Vanetta Perry from the March of Dimes. And from the Northeast Ohio Recovery Association, from Ophelia House, Miss Anita Bradley had to leave, and now we have Kathy Davis with us. We have a friend from Ohio Guidestone who wasn't able to make it this evening, but that was Megan Kilpatrick, but we're still thinking of Ohio Guidestone, and I know they're sending us their best wishes. And from the Hitchcock Center for Women, we have Sue Tager. Let's see. And from the Licata Way, we have Tom Stuber. So representing the Masters of Social Work program this evening, we have some students, and when I call your name, just please stand. Shannon Hoff-Smith, Hannah Bash, Darren Riley, Jason Kraft, Nicole Smart. You can stay standing, please. Whitney Jones, Shaquita Dorman, Jessica Anko, Christine Polgar-Fawcett, Brittany Duvin, Deborah Fitzpatrick, and Rebecca Krenz.
Also like to recognize the occupational therapy students from our master's program that are present and participating this evening. Again, stand Allie Bates, Claire Horseman, Maria DeLucia, Tia Sobik, Samantha Malloy, Elena Falsi, Mackenzie Whitelock, and Andrea Matanovic. Thank you. I'd also like to recognize the physical therapy students, Amina El Sharkawai, am I saying that right? I probably butchered it, sorry, and Summer Roberts.
Good evening, I'm Sue Bruce. I'm Chair and Professor of Pharmacy Practice at Northeast Ohio Medical University, and I'm pleased to introduce our two P3 third-year pharmacy students that are joining us tonight, Brittany White and Dondi Bostwick.
So I hope that everybody recognizes that these interprofessional teams have had just a few weeks to put together these amazing presentations that we're going to be hearing tonight. And we had a total of 5 teams that assembled, and now we want to recognize the 2 teams that are receiving an honorable mention this evening. The first team is Group 2, and they presented us with a proposal for a new pilot program at Ophelia House, which is part of the Northeast Ohio Recovery Association. And their proposal was to provide services to mothers who have been prescribed prescriptions, but then are no longer continually prescribed that medication and are left feeling potentially addicted or feeling, it's really addressing the people who are sort of borderline and might become addicted, and they're really in a precarious situation when their prescription runs out. So their proposal was to run a program for those individuals. And so we would like to call up the individuals from that group. Hannah Bash, please come forward. Allie Bates. And please. Dondi Bostwick. Andrea Manitovic. And Christine Polgar-Fawcett. So please join me in recognizing their good efforts. Also, as part of our competition, we had a group that was working their proposal was to provide a multimodal program, including drug screening, therapy, case management, occupational therapy, relapse prevention, and assistance with housing and daycare. And their proposal was to use the March of Dimes to provide education and support to mothers in the community. Please come and join us at the front, Brittany Duvin. Elena Falsi, Deborah Fitzpatrick, Rebecca Krenz, and Tia Sobek. Congratulations. So at this time, we're going to call up our 3 teams that are going to be competing this evening, and we're going to start with our first group, which is our group number 1. And the title of their presentation is A Sustainable Solution for Opiate-Addicted Expectant Mothers and Their Families. So please come for your presentation. Maria DeLucia, Jaquita Dorman, Jessica Anco, Brittany White, and Mackenzie Whitelock.
this. And then we could probably stand over there. You want to stand over there, guys? Just because you're going to be there? I'm not going to be there. Can anybody? Hi. Good evening, everyone. How are you doing tonight? We're happy to be here. Thank you so much, everyone, for coming. I know a lot of you guys had things that you were previously already scheduled to do, so we really appreciate you taking the time to be here. I have been chosen as a representative of this group on behalf of the group, so I'm honored to be able to stand here and complete this presentation. But everybody put forth, do you want to come on over? Oh, are you going to be over there? Okay. I'll stand over here. But everyone put forth such a large effort in making this happen, and so we're going to go down the line and just kind of introduce ourselves here quickly and kind of what occupation or what discipline that we're here for. So do we want to do that really quickly?
My name is Jaquita Dorman, and I'm in social work.
Hi, my name is Mackenzie Whitelock. I'm an occupational therapy student here at Cleveland State.
Hi, I'm Maria, and I'm also an occupational therapy student.
Thank you.
I'm Brittany White. I am from Neomed, and I am in the pharmacy.
And I'm Jessica Onko, and I am with Social Work Master's Program. So tonight we wanted to start out by having you guys do a little exercise with us. So if I could have you all, on a count of 3, we're going to turn to our right, and we're going to say the words, "You matter," to the person to our right. Is everybody ready? Find someone on your right. It might be far away, but we can do this. Are you ready? You're going to have to reach over. You might have to talk to a coat, okay? So everybody, on the count of 3, ready? 1, 2, 3. You matter. Excellent. I think it could have been a little bit better, though. Okay. So we're going to try this one more time. If you have to talk to the chair, just pretend someone's there. And we're going to turn our heads now to the left, and we're going to try it one more time, but we're going to say it with enthusiasm, because that chair matters, okay? So 1, 2, 3. Yes. How did it feel? Does it feel good? It feels good to matter, right? So we're all here today for the same thing. We want someone who is pregnant, someone who is addicted, to know that she matters. How many times do you think that she walks by someone and they reach out to her and say that she matters? How many times do you think her family lets her know that she matters, or the community? And actually professionals. So we do have to address the fact that the stigma does exist out there for her, and that does make it difficult for her to obtain the treatment that she wants, and then in addition to that, to sustain the treatment that she wants. So that's why we're here today. This group of individuals put together something that looks like a solution that not only can exist right now, but can be sustainable all the way through for this young lady. And by the way, so I don't have to keep saying young lady, we're going to call her Maria, because I like the name. So I'm going to be addressing Maria multiple times in what we're talking about this evening. When we took on this project, we looked at it as an assignment, stutter dare, and we looked at the syllabus, and we looked at the rubric, and we knew that we had to get this assignment done. But then a couple weeks into it, as all of us started talking and meeting together and working through solutions, we actually felt that there was more to this than that. And actually, I called and left a message with her and said, is this something that we could actually do? Because we were into it. And it turns out it is something that we can do. So we all got motivated to start talking to some people in addition to research, and find out from people that are already in the industry, people who are in the business, that know what has worked and hasn't worked, and what can make this happen for individuals now. And that was important to us because it needs to happen right now on this level. So when we started talking, we came up with a plan of wraparound services. All of us, I'm sure, in this room are familiar with wraparound services, but the package deal that we were suggesting is in a pilot program at Ohio Guidestone. If any of you are familiar with Ohio Guidestone, it is a nonprofit organization that deals in mental health. It spans across 37 counties, And it's working with a multitude of individuals, all ages, all cultures, it doesn't matter. They already have collaborative efforts out in the community. They work with the Adams Board, OMAS, they work with individual community sectors. They also work, right now we have, I hate to use the word absorbed, but we've absorbed a couple of facilities that actually were already doing opiate type of work in Tuscarawas County and in Lorain County, and we kept those programs existing at Ohio Guidestone. And they taught us a lot. The employees there taught us a lot, and we were able to utilize that to move forward in our efforts towards opiate addiction. But now what we're suggesting is how we can work with someone who is pregnant and addicted to opiates. And that's gonna take more than just a mental health service. That's going to take collaborative efforts with local hospitals, an OBGYN who has the specialties and the expertise to deal with someone who is addicted. MAT, medication assisted treatment that we can't provide in mental health services. So we're gonna have to look at licensure regulations, and we're very well aware of that. But what we're excited about is that Ohio Guidestone already has many of the programs. Am I blocking view for everyone? Can you all see? Okay. It already has many of the existing programs, and that's a good thing when you want to get started right away. And the other programs, it is actually already collaborating with several programs. We just don't have them tied into one wraparound service. So if we can bring those programs together into one wraparound service and piecemeal funding together through stakeholders that are invested in learning what we're all about and where they can kind of catch things on the front end for this individual, then we can all sit down at a table and talk about what that's going to look like. The good thing is, I have to mention this, we're gonna talk about the F word for a second, and that is funding, right? Because nobody likes to talk about that, but it is important when you're talking about treatment. It's kind of taboo in the social work field because it's all about the individual, but it is all about the individual. You have to talk about the funding, because if a program doesn't exist, then we don't have the treatment, right? But I'm not talking about funding like everybody thinks. I'm not talking about funding like, please everybody listen to me because we need your money, right? I want to tell you guys something exciting, and that is that the funding is already existing. It exists on the back end. It is existing in reactive solutions that we are currently investing in. Medicaid has a lot invested in taking care of these mothers and their families. The court systems have a lot invested in it. There's a lot of people in here who know that there are different systems that have a lot invested in reactive solutions. But we are looking for proactive interventions. So we want to attack this on the front end, and we want to get her the help she needs, her children the help she needs, because there are probably other children involved. And there's children and family services are always dealing with those issues out here in the reactive sector, and they're wanting so bad to tackle it right now. Everybody wants a proactive solution. So since we all want the same thing, it only makes sense to put everybody together and find one localized solution as a pilot program to start up something that can really tackle this. The problem when you sit down, anybody knows if they've sat down and tried to have these collaborations, that everybody has a different intent behind the actual, everybody wants the same outcome, but everyone has a different treatment approach to the outcome. And that's okay. I'm only mentioning the problems because it was part of the assignment. But we know that problems exist in meeting collaboratively. They're supposed to. We're all different thinkers, right? But I think that we can all sit down and come up with a sustainable solution and start with that pilot program. And it's not the monies that we're nervous about. It's about being able to get the right outcomes when we do that. We want to make sure that everybody is getting, documenting their outcomes, their data, and we collect that data, and we're able to look at what worked and what didn't work in doing that pilot program. Then we want to talk about a sustainable solution past that. That's what's important, the sustainable solution. And there are a few different ideas, but funding is one of them. We have to look at a streamlined approach at funding. Medicaid does that already, and actually in 6 different states they do something in the community. It's called ACT, and it's assertive community treatment. I don't think that's currently happening in Ohio, but I could be wrong. That's not my specialty, okay? But it streamlines funding if you create a wraparound service and everyone is in agreement. It will give one fund per day that will be distributed amongst the professionals in that wraparound service. If they receive services that day or not, here's the one fund that you are getting. So that's really important that we look at something that can deliver all the services in one package and fund them just the same. I also mention Medicaid because all of the data input and data entry is also put into one system. That is so important when we're trying to get something that is factual and have data that we can actually read and in between professionals. That's super important. We also want to look at co-locations. So in talking to Ohio Guidestone, one of the biggest concerns is that people can't get to treatment sometimes. Well, Guidestone has a pharmacy already that they operate. They also bring in people from university hospitals in addition to that metro. And we utilize collaborative systems already for our approaches, but we don't do it just for this particular situation. So it's important that we look at how we can bring this all together for this type of situation, and then we sustain that care by having one streamlined set of funding. That doesn't mean that this care cannot continue and sustain, because one other good thing about this is that Guidestone is in 37 different counties. It is continuing to expand. So if we have success with this pilot program, we will not only help Cuyahoga County, but we will extend out to other counties, and eventually it will be something very well known in Ohio, a plan that has been worked through and redeveloped and redesigned and challenged. So that is what we're here as a group to offer you today, is that sustainable plan for this young lady, Maria. That's what I named her, right, Maria? And we're gonna hope that Maria will get her needs met and then sustain through that plan. So thank you all for your time, and that's all. Thanks.
All right, thank you very much. My name is Scott Atkinson. I'm from Neomed in professional education, both at Neomed and CSU in simulation. The next group I'd like to call up is Group 4. It's the Hitchcock Center for Women, Amina Phelps, Jason Kraft, Nicole Smart, Samantha Malloy, and Whitney Jones. Got that right? All right. I was just gonna. Oh, do you want to move the mic off or just? No. Okay.
Well, first of all, I'd like to say thank you on behalf of Group 4, which includes Whitney Jones, social work, master in social work, Amina Phelps with physical therapy, Samantha Malloy from occupational therapy, and Nicole Smart, I almost had it, with social work as well. Thank you for this opportunity to become part of the solution to address the opioid crisis here in Cleveland. This has been a challenging yet a very valuable experience for all of us, and we look forward to sharing our ideas with you. At this point, I'd like just to share some information about the opioid epidemic here in Cleveland. and nationwide. So according to the National Survey on Drug Use and Health, from 2007 to 2012, there was an annual average of approximately 21,000 pregnant women aged 15 to 44 who misused opiates in the past month. Opioid use was most common among those aged 15 to 25 as compared to those aged 26 to 34. And opioid misuse was more common among pregnant women living below the federal poverty level as compared to those living at or above the federal poverty level. And then according to the 2012 treatment episode data set, 21,553 female substance use treatment admissions aged 15 to 44 pregnant women were pregnant upon entry. And of those admissions, 22.9% reported a heroin as substance of misuse. And then 28% reported a non-heroin opiate as a substance misuse. And then research. Go ahead. Okay. Go ahead. I'm sorry. One more. And research also indicates between 2000 and 2009, opioid use among women who gave birth increased in the United States from 1.19 to 5.63 per 1,000 hospital births per year. And that increase also had an increase in the number of neonatal abstinence syndrome among newborns. And with this syndrome, newborns are experiencing drug withdrawals as a result of maternal opioid use. Some of the symptoms that you will see associated with neonatal abstinence syndrome is the low birth weight, the problems breathing, seizures, difficulty feeding, tremors, irritability, sleeping, vomiting, diarrhea, dehydration, and sweating. So as you can see, that opioid misuse has a tremendous negative impact on the mothers, the infants, and the newborns. And right now, we'd like to share some of the contributing factors to this.
So according to the Substance Abuse and Mental Health Service Administration, there's 4 levels that they consider when it comes to the contributing factors. The first level is the individual level, which is the specific to the individual, so their age, their education, and their income and their health. The second level is the relationship level, and I just spilled water everywhere, and I'm so sorry. I like to talk with my hands, so I was talking underneath. Didn't work out very well. So the relationship level is the individual's closest social circle. So the family members, their peers, their friends, even places that they might work or their teachers, people that they interact with who could influence them to use or not to use. I'm sorry. The third level is the community level. So this is where social relationships occur, such as schools, the workplace, and the neighborhoods that they might live in. So these factors can have both negative and positive associations. The societal level is the fourth and final level. So that is just like the cultural norms based on the person's culture. Other significant factors operating at this level include the health, economic, educational, and social policies that contribute to economic and/or social inequalities between populations. Continued on contributing factors include, as shared by the Ohio Department of Health in 2013, changes in clinical pain management guidelines in the 1990s, and aggressive marketing by pharmaceutical companies of new extended-release prescription opioids to physicians. Marketing of medications directly to consumers, overprescribing substance abuse, widespread division of medications, deception of providers including doctors, shopping and prescription fraud, illegal online pharmacies, over-medication and mixing medications, and improper storage and disposal of excess medication.
So this is just like some statistics about the need for services in the community. I thought like definitely the most staggering one out of this is that Ohio has experienced nearly an 800% increase in fatalities since 2000, with heroin and fentanyl being major contributions to those fatal overdoses. And then also, out of all these statistics, nearly a third of children in custody are there because of this epidemic. And that number doesn't count the many children that are there, are not in services, but are with family because of the epidemic going on with their mother or father. So this is largely responsible for an 11% increase in children in custody in just the past 6 years. So fortunately, a lot is being done on levels to combat this epidemic. And at definitely the community level in particular, there's lots of organizations, hospitals, government agencies, and individuals who are working together to provide access to resources to help people such as a woman in our case study, Pamela Brown.
So the evidence shows that the integrated treatment model are essential for addressing the many needs of pregnant and parenting women with substance abuse disorders. These programs ideally combine medication-assisted treatment with additional series to assist pregnant women with substance abuse disorders. Pregnant women and mothers with substance abuse disorders and integrated treatment programs have better outcomes when compared to women participating in usual substance abuse disorder treatment, so like IOPs and stuff like that. Participants of integrated programs express greater satisfaction, largely due to a judgment-free environment, because they are usually with clients that are going through the same thing that they are going through. These women also report a greater likelihood that they would return back to the program if necessary, which is greatly beneficial. Of the many services that may be offered in an integrated program, behavioral health treatment is likely one of the most important, due to largely to the high incidences of comorbid mental health conditions that occur in women with substance abuse disorders. So to implement an integrated treatment model may benefit from multiple disciplines working together to offer solutions and provide services, provide maximal positive outcomes to the clients, as well as to enhance communication amongst multiple providers and streamline costs. This is the mindset with which our group came into this competition with. It approached our analysis and development of suggestions for our selected organization, the Hitchcock Center for Women.
Okay, so prior to, as part of the assignment, we were given a case study, and in the case study, it was a young lady who was the mother of 3 kids and somehow injured her leg in a car accident, I believe. And initially, she was fine, but she was prescribed either Vicodin or Percocet and became addicted to opiates. So I just want to give a little bit of background about Hitchcock and why I feel that our person, I believe her name is Pam, will benefit from this facility. So Hitchcock was founded in 1978, and initially it started as a 4-bedroom home on Magnolia Drive. Initially it was aimed towards helping women who were addicted to alcohol, and then later on down the line, here we are, and we have it as one of the leading facilities that help treat all forms of addiction in women. So some of the partners and funders that it has is the Adams Board, where they get some of their funding, the Cleveland Red Crisis Center, the Jewish Foundation of Cleveland, Huntington Bank, and United Way. Some of the services that it provides is housing for women and their children to up to age 12. So I thought that this would benefit Pam because, like I said, she does have 3 little ones and she's pregnant at the moment. So I think this will be good, where she would be able to still parent her children, still live at this facility and work. So I thought that would be good for her. It has a residential facility, intensive outpatient treatment, IOP, outpatient services that include counseling and community psychiatry, CPST services, aftercare, and alumni services as well. Okay. So some of the recommendations that we thought would benefit the Hitchcock facility would be some sort of education and support as far as helping the women who come into the facility who don't have housing or who are homeless. So that will be an addition. Breastfeeding education classes, which we'll talk more about. Mindfulness and relaxation classes, and then community outreach aimed at prevention. So we thought this was big because you see females who are pregnant at a younger age and becoming addicted to opiates at a younger age. So that was the reason why we put that there. So our recommendation was for us to go inside of the schools, middle school, high school, and talk a little bit about opiates and addiction. So. It went back.
Okay, so the housing education classes that we are proposing that they offer, essentially just implementing more social workers within the center, essentially offering classes based on educating them on housing, because as we know, when they leave, they are more prone to go back to where they lived before, which is more prone to relapse. So if we are able to educate them on safe housing and helping them apply, then hopefully they won't go back to where they came from and have another relapse, so they'll have safe housing. And we said essentially like 6 months out from their graduation date, just to start preparing them, and that way they have housing lined up when they graduate. So the disciplines involve staff and alumni from Hitchcock Center for Women, including social workers who specialize in case management. The stakeholders involve staff and alumni, as well as students from local universities. Also involve individuals, families, and medical professionals. The challenges could be identifying staff, alumni, and social workers who have the knowledge of applying for county and sober living houses.
Okay, so studies have shown that infants with neonatal abstinence syndrome who are breastfed tend to have less severe symptoms. They require less pharmacologic treatment and shorter length of stay than formula-fed infants. Breastfeeding should be encouraged for mothers who are stable and receive an opiate substitute treatment unless there are contradictions such as HIV infection or concurrent use of illicit drugs. Breastfeeding also increases mother-infant bonding, enhances maternal confidence, encourages active participation and management of the infant. The Maternal Opiate Medical Support, it stands for MOMS, is a collaborative effort with various healthcare leaders and medical professionals to identify treatment practices for pregnant women dependent on opiates and eligible for or receiving Medicaid during and after pregnancy. Goals of MOMS is to improve maternal and fetal health outcomes, improve family stability, and reduce costs of neonatal abstinence syndrome to Ohio's Medicaid program. MOMS offer detailed information about breastfeeding, which focuses on why breastfeeding is important, finding support, breastfeeding myths, how milk is made, learning to breastfeed, common challenges, breastfeeding a baby with a health problem, and breastfeeding in special situations. Implementation is to share breastfeeding information with women in recovery at least one time per month. It involves staff and alumni from Hitchcock Centers. This is another addition. It involves staff and alumni from Hitchcock Center for Women, students from local universities specializing in nursing, as well as developing a partnership with Metro Medical Center, which has a mom's program. Stakeholders, it would involve staff and alumni from Hitchcock Center for Women, as well as from students from local universities, also involve individuals, families, and medical professionals. And the challenges would be actually identifying the staff, alumni, and medical professionals.
So as the data suggests, opiate misuse is occurring to young teenagers. And for that reason, one of the recommendations that we're also making is focused on prevention and getting out into the community and sharing information about drug abuse. You know, as summarized by the Ohio Department of Health, children whose parents talk with them about the risk of drugs are 50% less likely to use drugs as compared to those children who do not have this conversation with their families. So again, we would suggest for the Hitchcock Center for Women is to share information on drug abuse to the public through various venues, whether it's town hall meetings, churches, schools, universities, and community centers. And a way to present this information in a professional and personal manner is to utilize staff and alumni from the Hitchcock Center, as well as intern students from local universities. And another way to expand upon this is for the Hitchcock Center to join Ohio's Start Talking program. And it is broken down into 4 components. Know, Parents 360, 5 Minutes for Life, and then building youth resiliency. And it's that last component that we would suggest that the Hitchcock Center for Women focus on, because it looks at developing good behavioral health for the youth, especially their ability to resist substance abuse and addiction. And with that, we would also like to go ahead and focus on some recommendations from PT.
Okay, thanks. So PT may not be an obvious discipline to include in this solution, but we'd like to try and convince you otherwise. So although pharmacological and psychotherapeutic interventions are becoming more and more effective, relapse rates do remain high, leading to a need for adjunct therapies, such as the integrated treatment models that was discussed previously in the presentation. Our group believes that there is a role for physical therapy as an adjunct therapy, as there is high-quality evidence that exercise and physical activity contributes to lower onset of mental disorders, less prevalent substance use disorders, and a preventative role with regard to alcohol, nicotine, and drug abuse. Evidence also supports the therapeutic effects of exercise interventions, particularly on depression and anxiety, and shows that it can also help reduce chronic pain. However, high-quality evidence is limited regarding the efficacy of exercise and physical activity as an adjunct therapy in the treatment of opioid abuse specifically. Well-designed studies using appropriate sample sizes and controls are needed, and we thought that the Hitchcock Center could potentially provide a venue and be a participant in such research. Nevertheless, we have a good foundation, and there is a lot of general evidence on which to build. Multiple studies on exercise and physical activity's role on physiological mechanisms argue for a positive role in substance abuse treatment. For purposes of time, we have just listed them on this slide, but you can see that pretty much all of them are relevant physiologically to populations struggling with opioid addiction. So how exactly does PT fit in? So I feel like I really need to say that PT is not just limited to rehabbing people that have total hip replacements and other orthopedic issues. And PT's role is very adaptable and multifaceted. PTs work with a range of patients and clients and are trained extensively in anatomy, movement, and functioning from a holistic perspective, including relaxation strategies, breathing strategies, and pain management. We bring a biopsychosocial approach to how our environments and lifestyle choices affect our physiology, and that's key. There is a growing body of research on mindfulness, based therapies and their efficacy in treating substance abuse disorders, stress, chronic pain, anxiety, and depression. These types of interventions are easily incorporated into existing programming, including that at Hitchcock Center, and require little to no equipment or extra costs. Important to note is that mindfulness does not necessarily mean meditation, which can be very daunting to people. Mindfulness can include body awareness activities such as classes like yoga classes, Pilates, Tai Chi, relaxation and breath work, self-massage, group walking programs, and just simply education on self-awareness and pain management, which this population that we're dealing with for our case study could potentially really use. So based on this body of evidence, we would like to suggest the addition of mindful movement classes to the Hitchcock Center. These could be daily or weekly 45-minute group yoga or Pilates classes that incorporate mindful movement, awareness of body and breath, and techniques to relieve stress and promote relaxation. Disciplines contributing include PT, OT, and counselors, among many others. And some challenges that we identified might include a lack of a quiet place, hesitancy amongst clients to join a group activity, and potentially withdrawal symptoms that they are experiencing that might prevent them from regular participation and consistency in coming.
Okay, last but not least, we're going to talk about OT. So OTs work to improve people's quality of life by having them engaged in meaningful occupations. So the women who are at this recovery center, their main occupation has been involving themselves in substance abuse. So when they go through treatment, this is going to be a big change for them to change their occupation. They're changing their routines of everyday life, changing their identity. So becoming sober, it's definitely a disruption of the various aspects of their life, and they're going to have trouble coping with all these strategies. So this is where OT can really help. So we have implemented a group session. Those are the goals for our group session. And then I found a study from 2010 where an OT was on staff at a alcohol and a substance abuse recovery center for women. And this is a quote at the bottom from one of the women there. She said, "Some people think that we come here to be fixed, but you can't just fix this. You need tools, life skills to go back and work at being successful." So I think that's where OT really fits in. We're preparing them for what happens after they gain their sobriety. So the group that we're implementing is a self-development group. So it would be 90 minutes, once per week. And it's basically like the motto is a hope for recovery. We'll use like crafts and themes. We'll have a theme of the day. Like one that was mentioned in the article was holding on and letting go. Like taking aspects of themselves that they want to let go of and what they want to hold on to through their sobriety. And then the last part is stress management exercises. And I think that's really important because after they go through this treatment program and they're sober, being very stressed is like a high risk for them to relapse. So like having those exercises to know what to do when they're very stressed, so they know how to cope, have coping mechanisms so that they won't relapse again. And that is all we have for you.
All right, thank you, Group 4. Our final group tonight before judging is Group 5, the Lakota Way. So when I call your name, come on up. Shannon Hoff-Smith, Claire Horseman, Darren Riley, and Summer Roberts. Good luck.
Okay, hi everyone. Thanks for joining us tonight. We are Group 5. My name's Summer Roberts and I'm in the physical therapy program.
I'm Claire and I'm from occupational therapy.
I'm Darren. I'm from the social work program.
Yeah, I'm Shannon. I'm also from the social work department.
Oh. Oh. Yeah, there's something popped up over here. Just right click it. Okay. Okay, sorry about that. So, getting into the case, first I just want to talk about the problems that we identified in the case, just for everyone that's not familiar with it. So, we were given a case about a young woman named Pamela Brown. She's 25 years old, and she's a mother of 2, and she's currently pregnant with her 3rd child. When Pamela was younger, she was physically and sexually abused by her mother's boyfriend. And because of that, she was put into foster care. However, the sexual abuse was never acknowledged by her mother. So this is something that's kind of stuck with her for her whole life. She was in a serious car accident a few years ago, and this left her with some chronic pain. A doctor gave her Vicodin for this, and then abruptly, a year later, was just abruptly taken off of it. At this point, Pamela was already addicted, and so she was searching for things to cope with her withdrawal symptoms, and she turned to heroin, which she started using with her boyfriend at the same time. A few months ago, Pamela's boyfriend died of an overdose from heroin, and Pamela found out that she was pregnant with her 3rd child. So right now, where the case leaves us, Pamela is 8 months pregnant. She has not received any prenatal care, and she's currently worried about being able to take care of her children and also work. Okay, so some of the needs that we looked at in the community. Unfortunately, Pamela's situation is something that's common, especially in our community here in Ohio. We just put up a few statistics here to show you about the opioid epidemic in Ohio and how it's affecting people. So basically, there's an increase in the number of drug overdoses, the number of heroin-related deaths, and an increase in the amount of prescription opioids that are being given to pharmacies in Ohio. So looking at substance abuse and specifically pregnant women, women are more likely to be prescribed prescription opioids in higher doses and also for longer periods of time. And also substance use is associated with a low socioeconomic status, domestic violence, and trauma, and Pamela fits this profile. Some of the complications that can arise from substance use while pregnant: the baby is likely to be born with NAS, or neonatal abstinence syndrome. Some of the things that we can do for a baby that's born with this, there's pharmacological and non-pharmacological options. They can be given Subutex, which is reserved for when the neonatal abstinence syndrome is more severe. Some non-pharmacological techniques are more soothing things, such as swaddling, skin-to-skin contact with the mother, breastfeeding, pacifiers, and rocking. I know. Oh, yeah, I did that.
right, so the organization we decided to focus on is Licata Way the Key. So this is a nonprofit organization dedicated to providing substance abuse services. And one of the reasons it stood out to us is they prioritize pregnant women that are addicted to opiates. So the specific program, The Key, is located in Lorraine, and it offers several different programs. So some of them are residential treatment, day treatment, intensive outpatient treatment, aftercare, family group, symptomatic groups, and connections. And they also have a residential treatment, and that includes substance abuse programming, parenting classes, exercise, nutrition and wellness classes, daily inspiration, various group activities, trauma care, and connections with self-help groups. So the average length of stay for The Key is about 75 days. And approximately 90% of the pregnant mothers that reside at The Key have other children. So one thing that they offer is therapeutic care for the children while the women are receiving treatment. So infants are giving loving care, older children can enjoy preschool experience, learning, playing, having fun, and then children can also be assessed for any special needs and referred for appropriate services. So they offer a lot for their children as well. And then just to know, at any other times, the children are with their mothers. Okay.
Okay, the next thing we looked at is all the different disciplines that are going to be involved in helping Pamela out. You could tell from our history that she had a variety of different stressors and risk factors and things that need to be addressed in order for her to move forward, not just with her addiction, but in a life thereafter for herself, for her family. So first, the discipline we looked at was substance abuse. Of course, you've got, Pamela's going to be residential treatment is going to be the best thing for her. She has an active opiate addiction. She said she was almost homeless. She has 2 other children with her. So ASAM criteria is probably going to put her in a residential situation at this point. So that's nice that she can have her other children with her, but also she can bring her newborn infant back to the center with her, which is crucial because you can tell from the neonatal abstinence syndrome that it's very important that she's there to swaddle her child and breastfeed her child and keep her close and the skin-to-skin contact. That's going to be very important. Pamela is 8 months pregnant already, has not received any kind of prenatal care. So the chances are this infant is going to suffer from some kind of NAS. Along with the treatment that she's going to receive while she's there, there's going to be a variety of different things. There's going to be cognitive behavioral therapy, there's going to be motivational interviewing, she's going to learn some coping skills, relapse prevention. One of the very important things is the care is going to be trauma informed. Pamela has been physically and sexually abused as a child. The sexual abuse was never recognized, so she's carrying that with her. Her boyfriend, the father of the children, started using heroin the same time she did and then died of an overdose. So she's going to have some grief going along with that. She was in multiple foster cares. So trauma is a huge part of the opiate addiction for a lot of women, and so that needs to be addressed, maybe with some EMDR, a lot of different therapies, but we have to be cognizant of that. And then as Pamela progresses in her recovery, according to ASAM criteria, she'll be either moved to day treatment, intensive outpatient, aftercare, whatever that may be. But we'll work with her on that. Other things that are, life skills are very important. A lot of these women, especially a young woman who has moved out of her home at 15 years old, doesn't learn a lot of life skills. So we need to get her to get some parenting classes, some health and wellness classes. Just look at her holistically and say, how can we support you in moving forward in a successful life? Medical discipline is going to be a huge part of this. Again, Pamela is 8 months pregnant, has had no prenatal care, and an active opiate addiction. She's going to need to get onto some kind of medicated assisted treatment. She cannot withdraw from opiates at this point. The chance of having a miscarriage, very high, premature birth, very high. So we need to get her onto some kind of substitute. That's also going to reduce the neonatal abstinence syndrome in the infant. And again, automatically get her in for some prenatal care. She's 8 months pregnant, hasn't had any yet, so let's see what we can do with that. And then we have our PT and our OT. She has obviously had a car accident. She's going to need some non-opioid pain management care. And occupationally, they said that she had been working in a fast food, kind of moved her way up, but that she was has significant pain in her job. So we have to help her out with that. But then she also is going to need a career eventually that she can support 3 children. So let's see what her talents are. She didn't have a strong educational background. Let's see where we can get her going from there. And then the most important thing is wraparound services. Dealing with the immediate medical concerns and an addiction, that's just one piece of it, okay? So, oh, do I need to do that? Are you doing that? Okay. Gotta get it where, okay. The wraparound services are going to be very important. So we've worked with her. Her recovery is under control. Her baby and she are now healthy. But now it's time to move on. Housing is a very crucial part, especially for recovering opiate addicts. Recovery housing is very important. She needs to go back to a safe, sober housing environment. Chances are she's still going to be on medicated assisted treatment, and a lot of the sober housing is not amenable to medication-assisted treatment. So that's another community barrier where we need to work with these people, with the Vivitrol, with the Subutex programs to find affordable, stable housing for these people. Vocationally, again, did not have a strong employment or educational history, so let's get her some training. Let's get her some placement with that. And childcare. Childcare is going to be huge. She has 3 children now. Childcare is provided for her while she's in treatment. The Licata Way will take care of the kids while she's in treatment, even though they're with her after hours. But now when she's out in the real world, she has, a starting wage job and needs childcare for 3 children. Transportation. We don't know whether she has a car that will accommodate 3 car seats at this point. How are we going to get her back and forth to work? How are we going to get her kids back and forth to childcare? So there's a lot of different wraparound services that we really need to look at to support her. And then it really needs to be case managed. These people are not aware of the resources. They don't know how to tap into them, and it becomes very overwhelming. Unfortunately, because of the 16-bed IMD rule, we have to reach out to a lot of different places to coordinate care, because a lot of it can't be conducted in-house because the staff is just simply limited. You can only have so many staff members in an organization that can only have a 16-bed facility. So those are a lot of the different disciplines involved and things that we were looking at, and I will give you over to stakeholders.
So in terms of our stakeholders, first and foremost, we're going to be looking at the pregnant mothers, also the many health professionals that Shannon just covered involved in implementing the program, and then we have community leaders, organizations, and other individuals that are going to be providing funding, and insurance companies. And then I also included the staff and the other individuals that are involved in Licata Way the Key that will be working directly with the mothers. So we have, well, not all directly, but some directly. Director, licensed independent social workers with supervision designation, treatment counselors, other licensed social workers, licensed chemical dependency counselors and assistants, an RN, a medical doctor, monitors, support staff, and then drivers.
Okay, so looking from a PT perspective, one of the main issues that pregnant women experience is low back pain, and this is something that physical therapy can really work with them to help decrease during their pregnancy. We can also work on things like relaxation and breathing techniques and different breathing exercises. If she does have a delivery with no complications, it's recommended that they start exercising 4 to 6 weeks after delivery. So at that point, we can focus on things like light cardio, such as walking, decreasing any low back pain that she's still experiencing, and teaching her safe techniques for lifting and carrying her children. And then after that, I would like to focus on the chronic pain that she's still experiencing from her accident that she had a few years ago, so that she has a non-pharmacological or non-opioid choice to help decrease her pain. And then also, if the baby is born with neonatal abstinence syndrome, there are a few things that physical therapy can do for that as well, if needed.
All right, Right, so in terms of occupational therapy, there's a lot of different things we can focus on. So one is going to be pain management, since she's been experiencing a lot of pain from her car accident. So this might include education, functional goal setting, training, and screening for additional referrals. Another big thing is coping skills and stress management. She definitely needs to learn a lot more of that to manage the stressors that she's having in her life. Another huge thing is adaptations at work and home. So she's not able to currently work. So giving her certain adaptations that she can utilize will help her get through her work day. Another thing is nutrition education for prenatal care, as we already mentioned. And then we're also going to try to address occupational deprivation. So is she engaging in things? What activities does she like? So that's just going to add more meaning to her life. So we're also, as OTs, going to explore that.
Okay, so looking at the challenges and barriers that we discovered, one thing that we could think of is trying to find funding to pay for all of the wraparound services that Shannon mentioned earlier. There are a lot of disciplines that would need to be involved, and if they don't get the funding, then pro bono care is one option that we could look at. Also, as Shannon mentioned earlier, there is the Medicaid Institutions for Mental Diseases rule, which limits residential institutions that are receiving federal funding to 16 beds. Licata Way, the Key does prioritize pregnant women, especially ones that are addicted to opioids, but this is still an issue with having only 16 beds. It can also limit our ability to provide holistic care for the patients. And also, just looking at something from the case, women are less likely to come forward if they have physical and sexual abuse because they're afraid of not being believed. And this could be something that Pamela and other pregnant women are facing as well.
External funding. Title V is an act from the federal government. It is put out by the U.S. Department of Health. It was given through the Health Resources and Service Administration. It's helped to fund prenatal care, postnatal care. It's given to all states. Agencies just need to apply for. Then through the state itself. Next one. I mean, here's a list of what we would need for the application. Preventive and primary care services for children up to 1 year of age. Preventive care for children. And it's a family-centered environment, service-related. Next one is a SANSA officer grant for treatment of pregnant and postpartum women, up to $1 million. Proposal budget cannot exceed that point. You must comply with all the state's requirements and have a public impact statement. It's a single state agency for substance abuse. Because all your qualifications, well, I mean, we have many more qualifications. And then the last one I found here was is a great grant that's funded through the Victims of Crime Act in the state. This is used to prevent babies from being born with NAS, and it's a varies amount. Yearly amount is up to $500,000. Your applications have to be reviewed by the Attorney General. You have the full finance records available on request. There have to be a program to help the victim rights, and we can use that through the postnatal care. Medical facilities is what we would be classified under. Even though it's chemical dependency, it still we could classify it under medical facilities. And that is just our references now. Everybody we got information from and everything like that.
All right, we want to thank all 5 groups. Wonderful job. And at this point in time, we're going to go ahead and do our judging. So our judges are going to go ahead and go to another room. If you haven't had any cake, or if you had, don't feel bad. Go on out, get some dessert, get some coffee, and we'll reconvene here at 6:30.
Are we good? Are we ready to go? So first and foremost, we sat downstairs, and a little background on myself. The one thing that I can tell you is I've only been involved in the issue of substance abuse for probably about 10 years, and I think collaboration is the key. And that's the one thing that really resonated for all three groups, I think, was collaboration, wraparound services, and I think this population that you're talking about, you know, young mothers, is definitely an area that needs to be improved throughout Ohio. But I think some of the words that really got us to who was number one was data collection, okay, evaluation, and the biggest word was stigma, okay? And there was only really one group that talked about stigma. And coming from a family that has substance abuse, the one thing that I will say is my mom is 75 years old this Sunday, and she still carries the stigma of doing a bad job with my family. So I think stigma is something from the mental health standpoint and also the addiction standpoint. You have to include that in your presentations. You have to include that in how you're going to approach this problem. Whether you're dealing with males that are Caucasian and 50 years old, or whether we're dealing with young moms. I mean, I think that's really important, okay? So all three of the judges were really impressed. I think there's a lot of work that could be going on with some of the ideas that everyone here shared, okay? So third place is actually going to be the group from the Hitchcock Center for Women. So if you guys could come on up, please, I think. So for this group, each student gets $150, is that correct? That's correct. So congratulations on your money. The runners-up are actually going to be the group that was working with Licata Way. So if you guys could please come on up. So this group actually is receiving, each individual is receiving $250 apiece for their project award. And group number one, please come on up, Ohio Guidestone. And the last award, the winning team actually gets $500 apiece. So congratulations to everybody. Lady,
A round of applause for our judges. And now we would like to bring up the agency representatives who were so kind as to join us this evening. Please, Vanetta Perry from March of Dimes. We're honored to be making a $250 donation to the March of Dimes this evening. We'd like to call up Kathy Davis with the Northeast Ohio Recovery Association. Did she leave? She did. Okay, I'm sorry. We'll be making a $250 donation to the Northeast Ohio Recovery Association. I know Ohio Guidestone couldn't be here this evening, but we will also be making a $250 donation to Ohio Guidestone. Sue Tager, would you be willing to come up? And Linda? From the Hitchcock Center for Women. Thank you. We're honored to make a $250 donation. And finally, Tom Stuber from the Lakota Way. And again, we're happy to make a $250 donation. We want to thank you all for joining us for this interprofessional case conference this evening. We hope that we've gotten the conversation started not only on interprofessional collaborations for students, but also for the situation of opiate-addicted pregnant women and what we can do as a community to respond better and provide better service to them. Following this presentation, there's a couple of things for housekeeping issues. Number one, if you need your parking validated, please see. Can you give a flag? Thank you. And second, there are some to-go boxes. There's actually extra food, so you might actually get an extra prize of some extra food on your way out the door. And then finally, we're asking that each of the teams if you would please move to the back of the room, and we're going to be asking our photographers to take a picture of each of the teams with your agency representative. Oh, you didn't do that yet? We didn't do that. Oh, I'm sorry. I thought we already did this. I'm so sorry. My sincerest apologies. We would like to recognize our judges this evening. So please, Tony Niederreiter. Thank you. And Dr. Joan Papp, in recognition of all your great work with pregnant women. Thank you very much. And Vince Carafi. So thank you, everybody. We really appreciate everything that you've done.